What is the best laser for anti-aging that does not cause facial fat loss? I've seen some great before and after photos of people who had lasers where their deep wrinkles completely disappeared and their skin texture improved. However, I've also seen lots of bad reviews where people saw no difference at all, or they lost fat in their faces. Why do some lasers cause facial fat loss? Which laser is best for wrinkles, skin texture, but does not cause facial fat loss?
Thank you for your question. You're asking a question without submitting any photos, and you're asking what is the best laser that does not cause facial fat loss. And in the details of your question, you describe situations where you see great before and after pictures, where deep wrinkles are very well improved, and at the same time, you are concerned about so many issues surrounding patients who described significant fat loss. So you're asking what's the best laser for improving wrinkles and not getting fat loss. Well, I can certainly share with you my approach to patients who ask exactly the same question in my practice every day. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people look their best at every age is the core of my practice, and I have been using lasers and other technologies since almost the very beginning, since the mid-90s when the first CO2 lasers were introduced. So this type of question essentially reveals an understandable confusion that comes from conflicting messages from different interests, basically essentially saturating your perception of what is the latest, greatest, amazing technology that basically eliminates all the other previous latest, greatest technologies. And the answer to this question really lies in defining the problem. And this is something that essentially everyone overlooks. When the typical person looks at themselves, they look at the lines and wrinkles. It is not by any error that the cosmetics industry, the beauty industry where selling creams is a multi-billion-dollar industry. It's because people naturally want to treat what they see. When you come for a consultation, when I evaluate a patient with a similar concern, I begin every consultation first with the basic details of the major concerns, and then I take pictures. And when I take these pictures, I review these pictures with my patient. This is an opportunity to essentially educate, and I would ask you to consider what is more of a more methodical, systematic approach. And that's the point of having a consultation with a physician who isn't just trying to promote a particular device. Every device on the market has a certain benefit. Otherwise, the device wouldn't be on the market. Choosing the device for the right reasons in the right patients, that takes judgment. So when you think about facial aging, and since you're concerned about wrinkles and lines, you have to consider all the elements of facial aging. And so when I look at a patient, instead of thinking of an approach working from the outside in, I think of an approach working from the inside out. And there's one major basis for this, and that's the foundation of facial aging and volume loss. There are two things that happen with facial aging. There's volume loss, and that includes bone, muscle, fat, soft tissue, and then there's sagging and descent, or laxity. Well, when we start with let's assume that you're not quite ready for a facelift, but you want to deal with a lot of lines, wrinkles, and hollows. Well, at the foundation, it's bone loss that has the greatest impact on facial appearance. So, for example, if someone is bothered by lines and wrinkles and hollowing, Well, if we restored volume at the bone level, then a lot of that volume would actually help correct or improve significantly a lot of this concern of the appearance of the skin. And it's essentially when you lose volume, the skin folds and wrinkles and goes in. Now there's a difference, and there's also the issue of textural, but that's something we'll address later. In our practice, we do something called structural volumizing. So for patients who have a desire to see improvement, what I may do is first offer a procedure using injectable fillers at the bone level. And at structural volumizing, that means I'm addressing the underlying issue, whether it's at the cheekbone, the jawline, the jaw angle, or the chin. Those are the areas that are the foundation of supporting the face. Now, going from the inside out, you then look at what's going on under the skin. So below the skin is the layer of soft tissue or fat, which makes up a large percentage. You expressed a concern about people complaining about losing fat. Facial fat volume or fullness is a very important part of a youthful appearance. But there's a fine line. You don't want to overdo any kind of volume, but you want to create that support. So now we're going from the bone level to the soft tissue level. Now that's a place where a lot of things can be of value. Anything from soft tissue fillers, such as in the hyaluronic acid family, platelet-rich plasma to stimulate the fat under the skin, which can have a very nice effect on improving skin quality as well as improving the lines. And essentially thinking about modalities that can help improve the health and quality under the skin. Then we get to the skin level, and on the face, basically you're looking at skin that's about 2 millimeters in thickness. Now this is where the industry is quite wide and varied in the approach. Everything from lasers of different types, different levels, ablative, non-ablative, microneedles. There's a lot of options. So when you think about choosing an option, you have to also factor in what are the elements that you are really looking to improve, and how much downtime are you willing to experience. I can tell you from the mid-90s and moving forward that the biggest challenge with laser treatment was not necessarily the quality of the outcomes, but it was also the extent of the healing time. And I can tell you in the modern day, prolonged healing processes are something that a lot of people simply cannot handle with in their lives. So a lot of strategies that we employ involve a dual modality of doing something at the dermis level with various laser devices, as well as at the epidermal level. Again, with laser devices, as well as something as straightforward as water-based microdermabrasion like hydrofacial. So there is certainly no single answer to the question of what's the best laser. You really have to allow for the judgment of the doctor, and you and the doctor having a synergy, an understanding of a plan. A lot of times people look at their friends and will naturally make assumptions that such and such strategy worked for their friend. Why wouldn't it work for them? And I always say that it's essentially you have to look at not just what you may appear like on the outside, but look at the issues from the inside out. And then with a systematic approach, you can then choose what you are interested in pursuing. A lot of people come to us who have been disappointed with the latest, greatest device because they expected a lot more than that device as a standalone can deliver. Very often it's a combination approach that gets the best outcome. So what you need is, of course, a treatment plan. And so meet with qualified, experienced doctors who perform these types of procedures, who have extensive experience, and get a sense of their strategy, and what hopefully you'll be able to screen out is any significant biases towards pushing a certain device over everything else. And if someone says this is the best device ever, well, that's concerning, because these devices are, generally speaking, are very useful, but they have to be used correctly. So I hope that was helpful. I wish you the best of luck. Thank you for your question.